Assalamu alaikum everyone. I hope you all are fine. Today I am going to make a video on the Ospe of the upper limb. This applies on all the disciplines, that is for MBBS, BDS, DPT, MLT and nursing as well. The first of all, most commonly asked question or in the Ospe is, or it can be an interactive station, or it can be either the stationary station, static station, basically that a bone can be placed in the interactive station. The facilitator can ask to you about the bone, that identify the bone, name the bone, hold it in the anatomical position, identify the side of determination, whether it is a right side bone or the left side bone. And okay, now the most commonly asked question is, we were discussing that it can be asked to you to hold the bone in the anatomical position, and the muscle attachment can be asked to you, and the nerves related to that bone. The most common bones asked in the exams are clavicle, scapula, radius, humerus, radius, ulna, carpal bones, and metacarpals and phalanges. But phalanges, and they are not usually asked in the exam. The bones can be asked to you either in the interactive station or in the static station. Okay, now let's start our today's topic. First spot can be given to you on the humerus. Identify the bone placed on the station. It might be the humerus, and the facilitator can ask you to point out a surgical neck and mention its clinical importance. So it will be the humerus bone, and surgical neck is present just below the neck, below the head and the tubercles. You very well know there are two tubercles present on the humerus, greater tubercle and lesser tubercle. Its clinical importance it is that it is a common site for the fracture associated with the injury to the axillary nerve and posterior circumflex humeral artery. Now, second question which can be asked to you in the exam is the attachment of the deltoid muscle on the humerus, where it is attached on the deltoid tuberosity, which is present on the lateral surface of the humerus, that is mid shaft. The other question can be asked to you, please show me the groove for the ulnar nerve on the ulna. What is the significance? Okay, now you very well know that groove on the posterior aspect of the medial epicondyle of the humerus is present on the ulna. This is the tricky station. The facilitator can trick you to see your knowledge whether you are confused or not. So please do not get confused and be confident in your answer. Okay. Medial epicondyle is also known as the funny bone, area of site of the ulnar nerve injury and in the medial epicondyle fractures. Identify the carpal bone placed and which surface forms the part of the wrist joint. Mostly it is the scaphoid bone and proximal surface, which is most common due to the proximal surface the fracture or the avascular necrosis takes place in the scaphoid bone. It articulates with the radius to form the radiocarpal joint. Okay, now I have attached a picture over here so that you can better understand the anatomy of the humerus. This is intertubercular cube, there is greater tubercle, and this is lesser tubercle. Lesser tubercle is present over here, not here. When you talk about the femur, this is opposite side. This is greater tubercle is greater tubercle is present like this, but lesser tubercle, lesser trochanter. Greater in the humerus there is greater tubercle, and in the femur there is greater trochanter, and lesser trochanter it will be present in femur. In this side it will be like this outside. Okay, it will be showing in the radiology as well. But in the when you talk about over here, so if there is a two marks will be given, this is the head and this is the lesser tubercle. Okay, you can either write 2 points if you are confused that whether it is the head or the lesser tubercle. This is the bicipital groove, deltoid tuberosity, deltoid muscle is going to be attached over here. This is the nutrient foramen, and this is the radial fossa, and this is the coronoid fossa. Radial fossa will be on the radial side, and coronoid fossa will be on the ulnar side, that is the medial epicondyle, and this is the lateral epicondyle. RC radial साइड पे जो है वो हमारे कैपिटलम पड़ेगा, और M जो है वो MU पड़ता है, मीडियल एपिकोंडाइल पे अल्ना पड़ता है. ठीक है, इसको मैंने इस तरीके से याद किया हुआ है. और यहाँ पे ऑलिकोरोनन प्रोसेस है, और यहाँ पे मीडियल एपिकोंडाइल, दिस इज द lateral एपिकोंडाइल. Okay, now the question can be asked to you that please tell me the nerves related to that bone. Axillary nerve is present on the surgical neck of the humerus, radial nerve is present on the radial tuberosity, and ulnar nerve is also present on the medial epicondyle of the humerus. Identify the bone Another bone can be given to you, that can be either scapula. It is a flat triangular bone. It has a prominent spine dividing the dorsal surface. It has a glenoid cavity on the lateral angle for humerus articulation. It can be asked to you in the exam, it is the glenoid cavity or glenoid fossa. Both names can be written either in the bracket form. Okay, both are correct. Point out the borders of the scapula on the bone: superior border, medial border and the lateral border. In my radiology video you can better understand it. I have also attached the picture over here so that you can know the attachment of the muscles. Muscle attachment is very important on the scapula. Okay, you can, this is the anterior side. Let's talk about the anterior side first. Now you can see on the anterior side, serratus anterior digitations are present like this. This is the subscapular fossa, and on which subscapularis muscle is attached. When you talk about the posterior side, supraspinatus fossa is present over here, and on the infraspinatus fossa is present on this side. And basically this is the acromion process, and coracoid process is present behind it. Okay, on the acromion process muscle attachment can be asked to you. On the coracoid process muscle attachment can be asked to you like this. Levator scapulae is present on the upper part, and the rhomboid minor is present on between these two parts, or the spine, which is dividing it into the supraspinatus and infraspinatus. And this is the rhomboid major muscle. This is the inferior angle, superior angle and the lateral angle, or the glenoid fossa. Okay, now show the angles of the scapula, which we have already discussed. Now show the spine, which we have already discussed. On acromion process, deltoid and trapezius is attached. You can learn it like this, like that means deltoid and trapezius are attached on the acromion process, and on the coracoid process pectoralis minor, short head of biceps and coracobrachialis is attached. Now subscapular fossa, supraspinator, the examiner or facilitator can ask to you to point out the scapular fossa, supraspinatus fossa or infraspinatus fossa, and the attachment of the muscles. The name indicates the muscle. This is very easy. Okay, on the subscapular fossa, subscapularis muscle, supraspinatus fossa, supraspinatus muscle, and infraspinous fossa, infraspinatus muscle is going to be attached. Showing the glenoid cavity or the glenoid labyrinth is present, which is also called the lateral angle. Its clinical importance is from the shoulder joint, which is also known as glenohumeral joint. With the humeral head, it is prone to dislocation due to the shallow depth. I have also attached a picture. Okay, the clinical importance is that there is a winging of a scapula, which is due to the injury to the serratus anterior, which is supplied by the long thoracic nerve. Commonly asked question. It can be asked to you in the Viva question as well, or it can be asked to you in the in this Ospe station as well. Okay, this is the anterior border in which you can see the radial head, neck and radial tuberosity, and this is the introitious border. This is the anterior border, and this is the distal tubercle or distal Lister tubercle or tubercle of Lister. Okay, both names are same. This is the styloid process. It can be asked to you, or the examiner can ask to you to point out the parts of the upper parts, or it can the facilitator can ask you to point out the radial tuberosity and attachment on the radial tuberosity, or on any part it can ask to you. Okay, now the given bone was the radius, lateral bone of the forearm. It is present on the thumb side. It has a head and it is also a neck, and the distal end is broad with the styloid process. Ulna has a narrow distal end. Show the head of the radius. Name one structure attached to its neck. And the head articulates with the capitulum superiorly and radial notch of the ulna and neck. On the neck there is the attachment of the annular ligament. On this in this video you can see A is the anterior view and this is the posterior view. On the anterior view you can see these muscles are attached like this, and this is basically the ulna, and this is the radius. Okay, and this is the radius and this is the ulna. Okay, now you can see on the that radial tuberosity bicep brachii muscle is attached over here. Okay, here it is also written that radial tuberosity, which muscle attached is present. Bicep brachii tendon attached at radial tuberosity. Also it gives attachment to the bicipital bursa and supinator muscle posterior part. Posterior part of the supinator muscle is also attached over here. Interosseous membrane attaches along the interosseous border. Identify the styloid process of the radius. It is present below. Styloid process I have already shown you. Radial collateral ligament of the wrist joint is attached over here. Dorsal tubercle I have shown you the Lister tubercle, and its clinical importance is that it acts as a pulley to change the direction, and located on the dorsal aspect of the distal radius extensor pulsus longus tendon uses it as a pulley. In a fall or an outstretched hand, which part of the radius is commonly fractured? Distal end of the radius is fractured. Okay, now this is the clavicle. Clavicle is also very important, that can be asked to you in the exam as well. The examiner or the facilitator can ask you to hold the position in the anatomical position. This is the medial end, this is the sternal end. It is the rectangle. It is in rectangular form, and the lateral angle is the acromial end. Okay, this is the acromial facet. So this is the right clavicle. Okay, I have already told you that the medial end is the rectangular, and the lateral end is the it is triangular. Okay, this is the sternal end or the medial end. It is the acromial end or the lateral end. This is the anterior view, and this is the superior view, and this is the inferior view. On the inferior view, subclavian groove is present on which the subclavius muscle is attached. On the inferior view, you can see the costal tuberosity and conoid tubercle is present. On the conoid tubercle, conoid ligament is attached over here. On trapezoid line, trapezoid ligament is attached over here. Okay. Now the joints can be asked to you that which form the costoclavicular joint is formed over here. Sternoclavicular joint. Okay. Costoclavicular ligament is present over here. This is the conoid ligament, and this is the trapezoid ligament, which I have already told you. This is the costoclavicular joint or the sternoclavicular joint. Both are the same. Okay. Shaft is okay. This is the anatomical position of the clavicle. Shaft is placed horizontally. Medial end is thick and quadrangular at articulate with the manubrium of the sternum. Lateral end is flat at articulate with the acromion process of the scapula. And shaft is convex forward medially and convex forward laterally. Superior surface is smooth. Inferior surface is rough for the ligaments and muscle attachments. Now the facilitator can ask to you on the clavicle that please show me the conoid tubercle and mention the attachment. So on the conoid tubercle, there is conoid ligament is attached, trapezoid line, trapezoid ligament is attached, and the medial end there is manubrium of the sternum with articulates with the first costal cartilage or form the sternoclavicular joint. And there is the which part of the clavicle is most commonly fractured? Junction of the medial 2/3 and lateral 1/3, because it is the weakest point and it lacks the muscular reinforcement. The point on the subclavian groove, point out the subclavian groove, and the attachment of the subclavian groove is the subclavian. On the subclavian groove, subclavius muscle is attached, and it also gives attachment to the clavipectoral fascia.